I don't know if like many people would immediately see a strong link between ADHD and pain, but actually we know that people with ADHD are much more likely to experience pain. There's some kind of biological elements to it. So one possible explanation is that people with ADHD and people with chronic pain both have higher levels of inflammation within the nervous system. So that might be a common factor between the two.
And your nervous system is the thing that kind of regulates pain.
Yeah, exactly. In ADHD, the brain is kind of telling the muscles to maintain a kind of persistently high muscle tone, which means that the muscles get kind of fatigued and uncomfortable and painful. And actually some people have proposed that this might partly explain the physical restlessness of ADHD. Essentially people are feeling
ready to go all the time.
There's also kind of psychological components to it as well, because how we experience pain is very much related to attention. And for people with ADHD, they might have more difficulties with disengaging their attention from pain. There's also evidence actually that people with ADHD have greater pain sensitivity, so they're actually feeling the pain to a greater extent.
Why is that?
We don't really know. It might be to do with the attention. Like it might be more difficult to disengage your attention from the pain, so you're experiencing it, like your subjective experience of it is greater. It might be to do with greater sensitivity to do with the inflammation that we were talking about. I think all of these things are kind of like connected and kind of all play a role.